investigation is done by district surveillance teams within the provinces working for the Department of Health. So they go now and they do a detailed investigation of each and every one of these cases. And as you can see, they collect a lot of information. While doing that, they complete a case investigation form. So all of these things that you see on this list, they collect in the form of evidence. So that could include, for example, laboratory results, clinical reports from the medical practitioner, which vaccine was administered, an interview with the vaccinator who administered the vaccine, an interview with the patient, and with the family if necessary. So when all information is available, when the whole case investigation has been concluded, then all the information is now sent on to the National Immunization Safety Expert Committee, and they are then responsible for doing the causality assessment. Now, with the causality assessment, it is a scientific process that's being followed, and we are using a well-recognized methodology by the World Health Organization, as you can see here on the left hand of the screen. So there are a certain number of very important factors to consider when you do a causality assessment. And this means that you go through a systematic review of all the data, in other words, all the documents and the data collected during the case investigation to determine whether there is a likelihood of a causal association between the event and the vaccine. So now we will look at each of these factors. So the first one, before you can actually start with the causality assessment, you need to make sure that this is actually an eligible case. So that means there must be a patient name or an ID. There must be a date of birth and a sex. There must be a known vaccine. You cannot do a causality assessment if you don't know what the vaccine was. And then there also must be a valid diagnosis. So valid diagnosis means there must be a case definition for that diagnosis. So to give you an example, death is not a valid diagnosis because there must be a cause of the death. So, you know, if you don't have a valid diagnosis, for example, if you have, you know, a couple of notes from a doctor or from a hospital, or maybe no notes at all, and you don't have an autopsy report, you cannot come up with a specific diagnosis. And then the case would end up to be eligible for causality assessment. So an example question is, did the Comirnaty or the J&J COVID-19 vaccine cause anaphylaxis in this patient? So anaphylaxis would then be the diagnosis. Now, the second point is there strong evidence to confirm another cause for this event? So to look at that, you look at the medical history from all the patient records, and that's why you need all the patient records. Furthermore, you look at the clinical examination by the medical professionals throughout the journey of the patient. And then you also look at investigations, for example, a laboratory report or an autopsy report. So in the case of a death, one of the investigations would then be an autopsy report. In the case, say, of a COVID-19 case, there would be a laboratory report showing evidence that the person tested positive for COVID-19 and also when the person tested positive. The next one is then you look for whether there is a known causal association with the vaccine or the vaccination. So this means that you now look at the whole process first, the vaccination process. So you look at whether it is possible that there has been a immunization error. For example, was the vaccine used beyond the expiry date? Was the cold chain observed? Was the vaccine well stored? Was it administered incorrectly to the patient? So this is why you also interview the vaccinator who administered the vaccine. Then you also consider whether it is perhaps a stress-related response. So, for example, in the case of where a person fainted, which is different from anaphylaxis, it could be a stress-related response. And this is common with COVID-19 as we are vaccinating adult people, and they estimate that approximately 10% of people have fear for needles and injections, so they might faint when they do receive their vaccine. Then to continue with that, you also look at the vaccine, whether the vaccine product itself caused the event. And this information you obtain from the literature. So this is known from the clinical trials, and you would find it in the product information. You also determine whether there is a biological plausibility that this event could have been caused by the vaccine. So just to explain this in a simple way, if you look at lung cancer, we all know that smoking causes lung cancer. So that would be a biological plausibility. But does lung cancer cause smoking? No, it doesn't. So that would not be. So just to demonstrate that to you. Then also you look for whether there are any tests demonstrating that there is a cause for this event. The next one is the vaccine quality. So that is also considered in each and every one of the causality assessments. Should there be something wrong with the quality of the vaccine? Should there be any substandard ingredients involved, or maybe falsified ingredient, or maybe a mistake in the manufacturing, whatsoever that might be. Then the next one is whether you look at whether the event happened within a specific time window. Now, all adverse events have, or most of them have, a specific time window, which makes it, logical that this would present. So I'm just going to use anaphylaxis as an example. Now, anaphylaxis is a very serious, severe allergic reaction. And that means that the vaccine recipient is allergic to one of the ingredients or the excipients in the vaccine. And this usually happens up to 1 hour after vaccination. It's very seldom that it happens, takes a longer period for it to present. It mostly happens within the first 15 minutes. And the good news is that it can be 100%, it is 100% treatable immediately with epinephrine or with noradrenaline. So that is the reason why people need to wait at the vaccination sites at least for 15 minutes to make sure that there are no allergic reactions. Then the next one is to look at whether there is any strong evidence in the literature against a causal association. So, is there already literature showing that this vaccine does not cause this particular event? So this is an example, a very well-known example, and it's about especially the mumps, measles, rubella vaccines, or some of the other vaccines being responsible for autism. So there's already hundreds of publications out on that showing there is no causal relationship between vaccination and autism. And this is just one of the examples of a meta-analysis. And then also you look at whether there are any other qualifying factors. So did this occur with this person in the past? Did this occur independent of vaccination? Could this event have occurred in this patient without him or her being vaccinated? Is that possible? Also, then you would look at, are there any pre-existing conditions or risk factors that could have contributed to the event? So depending on what kind of event it is, does this person suffer from a certain condition that could have contributed? Is this person taking any medication that could have resulted in this event? Because medications also result in adverse reactions, like you've heard from Flora. Also, have the person been exposed to other risk factors other than a vaccine, for example, an allergen or a herbal medicine. So to give you an example, say, for instance, someone is allergic to nuts. So they get the vaccine, and then maybe 15 minutes later or half an hour later, they are exposed to, they eat something and they didn't know, and they eat nuts, and they are allergic to nuts. So that would then be, then you need to determine, the reaction that you would then see, or the event, has it been caused by the nuts, or has it been actually caused by the vaccine? So here's just an example where we then would also look at the background rates. This is very important with COVID-19 when people present with certain diseases. So you would look at what is the background rate, or the normal rate, or the expected rate of a certain event. And then you would look at what is the vaccine rate to determine whether there are now more of these adverse events compared to under normal circumstances in unvaccinated people. So, and that also plays a very important role when you look at any deaths following vaccination. So you look at the data and you see whether there's now any unusual patterns or spikes in this particular event amongst the vaccinated people compared to the unvaccinated people. So once you've completed this whole process, then you are able to classify the event. So if you look now at the factors that I've gone through, it will make sense then to realize that you would either then classify this. So if you find that there is a causal association, so in other words, you find that the vaccine was the cause of this event, it could either be related to the product itself. So this means it could be one of the adverse or the side effects that we know of, or even the ones that are, less common. For example, swelling at the injection site. So the person developed a huge or severe swelling at the injection site, then that would be vaccine product related. The next one would be vaccine quality related, and this is very, very rare. So if, like I explained, there's something wrong with the quality of the product. Immunization error related. So if there is a problem with the process of administering the vaccination. And then lastly, a stress-related response. So this happens where people have fear of injections. Then the next one would be inconsistent with causal association. And this is also very common now with COVID-19, where these events take place coincidentally to the vaccination. So the reasons for that is that people have comorbidities. We are vaccinating large populations of vaccinees. Many of them are in the older age groups where they have lots of comorbidities. It could be a newly diagnosed illness. It could just be something spontaneous. It could be something that the person is exposed to other than the vaccination. So this is where I then also explained where we look at the population-based background rates. In other words, the expected rates for that specific event. Now, just to illustrate that to you, so Flora will illustrate the microsite just now, but on the microsite, you will then see the deaths following immunization, and that's being updated once a week. So if you look at this, you will see that there has been up to the 31st of August, 86 reports of deaths reported following vaccination. And then they, as I explained, must all be investigated. 46 cases are still under investigation, and 40 have been investigated and causality assessed. Now, amongst the 40 that's been causality assessed, none of those were related to any of the COVID-19 vaccines we are using in South Africa. And as you can see, there 13 of them had died because of COVID-19 disease, and one of the cases was actually a breakthrough infection. So these people who died because of COVID-19, they had already incubated COVID-19 at the time of vaccination, or they contracted COVID-19 shortly after being vaccinated before they could mount, an adequate immune response. Now, just to further explain about the deaths following immunization. So the non-COVID related deaths have happened coincidentally after being vaccinated. So as you've seen, all this data are being considered before we come to a conclusion to say this was coincidental to vaccination or not. And there must be adequate evidence for that. If there's no adequate evidence, I'm going to go back, then you will see there's 6 cases which were unclassifiable due to inadequate information. So if we don't have sufficient scientific evidence, then the case would end up to be unclassifiable. So we can't say it was not the vaccine causing the event or it was something else causing the event. So what is important to remember that we are vaccinating an elderly population, a large proportion of them, and we've also seen the deaths in the more elderly people. And they have chronic comorbid conditions in virtually all of them. And what we also need to remember is that the main goal is to protect these people from severe illness, to protect everybody from severe illness, especially the elderly population. But they are at a higher risk of dying, but they are also at a higher risk of dying from COVID-19. So if they are vaccinated in time, the vaccination can protect them, but still it cannot protect them or prevent them from dying from a chronic illness. Then the last category is then the indeterminate category. So this could be a potential signal, like Flora also explained, and may be considered for investigation in future. So the causality assigned to these cases could change when new or additional information becomes available or additional cases. Then we would revisit these cases and the causality could then change. So there could be a temporal relationship, but it's consistent but insufficient evidence for the vaccine causing the event, or there could be conflicting trends of inconsistency with causal association to the immunization. And then the very last one is in the unclassifiable cases, like I explained to you. So this happens at the very start of the process, where cases could be completely ineligible, where you just have actually no information available, or it could happen towards the end of the process where you don't have enough evidence to say for sure this was not caused by the vaccine, or yes, it was caused by the vaccine. So thank you very much. I would like to acknowledge everybody who's contributed to strengthening the vaccine safety surveillance, like Flora has also showed you. And it's all about making sure that the vaccines that's being administered to the population is safe, and that also applies to the medicines. So thank you very much. You are muted, Mr. Sibisiso.
Can you hear me now, Prof?
Yes, we can hear you now.
I was saying thank you so much for that wonderful presentation. It continues to generate a lot of interest, as evidenced by the questions that continue to on the chat. I'll encourage participants of this webinar to continue sending questions through the chat. We have learned, or we have heard about causality assessments, the processes, the support systems and structures and teams that are available. This has been building on the information that's been provided earlier by Flora on the MedSafety app. And at this point in time, I'll ask Flora to come back and talk to us about the adverse events following immunizations reporting microsite. So I think, Flora, the floor is yours, and I'll encourage people to continue putting questions on the chat. We're curating the questions. We'll ask them to the different panelists at the end of the discussion. Flora, over to you.
Thank you, Sibusiso. Okay, I'm going to share my screen on the microsite. So please confirm that you can see my screen.
Yes, you can see your screen. I think the only thing is if it's possible at all, to make it a bit bigger in terms of the zooming in, but you can see the screen. If not, it's fine. We'll make do with what's there.
I don't think I'll be able to.
No problem. You can take us through.
So, as Portia has highlighted earlier, and I think I also touched on it a bit, to indicate that communicating the information that we receive with regards to the adverse events following immunization, it's of importance, particularly because of the use of the new vaccines, the COVID-19 vaccines in the country. So we thought it's important that we share the information that we receive with the public. So as you go, how you reach to the site where we share the information that Prof has shown a bit on her presentation. You will go on the SAHPRA website, and this will be the landing page. And on the landing page, we have what we call the e-services. So under the e-services, you go to the adverse events following immunization reporting dashboard. And this is where now all the information will be available. So please confirm that you can still see my screen.
Yes, we can.
Okay, thank you very much. So this is the landing page of the SAHPRA microsite and AFI microsite. So as you come on the SAHPRA microsite, you have different tiles on the left-hand side, and that will indicate what is under each tile. And then you have a disclaimer here. And the disclaimer, basically, it's what I touched on, and as well as what Prof has actually alluded to in her presentation to say, it's important to note that the adverse events following immunization on the site have not been assessed for causality unless otherwise specified, and therefore the events may not necessarily have a causal relationship with the administration of the vaccine. So hence it was of importance for us to actually clarify the differences between the adverse drug reactions and the adverse events earlier in my presentation and what Prof has actually included. So on the microsite, so we have information that pertains to the reporting of adverse events following immunization for COVID-19 vaccines. So what we did on this page, basically, we explained that what this microsite is all about. And then furthermore, we explain what is an adverse events following immunization, and Prof has covered this thoroughly. And further, we indicate that most of the adverse events that are seen following immunization, they will occur for about 2 to 3 days. And then after that, they will actually go away. And then we also provided the groupings, the 5 groupings of the adverse events following immunization. And we touched on the Sisonke as well. As the rollout, basically, it started with the Sisonke phase 3B clinical trial, where it was monitoring the effectiveness and the safety of the COVID-19 vaccines among healthcare workers. And then we say, when did it start? When did it come to an end? How many people were vaccinated? And then more information. What's important to note is that the adverse events from the Sisonke study, they were not reported to SAHPRA they were reported to SAHPRA rather under the clinical trial framework, but not under the pharmacovigilance unit. So hence we did not include those here. So if you want more information, then you go here and then you'll find more information regarding that. Then furthermore, we highlight when did the national rollout start and with which vaccine and followed by which one. So it started with the Comirnaty, and then it was followed by the COVID-19 Janssen, and we also attached the professional information and the patient information leaflet or the fact sheet, those that are available at the moment, so that the public would have more information with regards to the COVID-19 vaccines that they are being administered. So finally, what we have included here is to say that what is the relationship between SAHPRA, what is SAHPRA's mandate, what is National Department of Health mandate, and NICEC as well, and what is their relationship and their responsibilities thereof in terms of monitoring the safety of the vaccines following immunization for COVID-19. And we also have a link to the MedSafety app. If you press on it here, then you will be able, it will take you to the MedSafety app. And then below that as well, we also have a disclaimer at the bottom to indicate that the information on this site, it's not causality assessed unless otherwise specified. Okay, so on the tiles on my left-hand side, then we will move to the definitions. We have put a number of definitions together for the public to understand. So as you click on each definition, then it will provide more information. But what we have done, we have tried to simplify it so that it can be easy to understand. And we have tried to cover the main information or the main definitions that will be relevant in this case, so that when somebody goes and check what is a vaccine, then they will understand what's a vaccine. What do we mean by a serious adverse event following immunization? What is pharmacovigilance? And then what is safety signal? So we have provided a number of definitions, which we will be increasing as time goes by. And then thirdly, we have a tile here that talks to how to report. So on how to report is exactly what I spoke to earlier, and is the MedSafety app. As you click here, then it will take you to this, and then it explains to you which phones can actually support the use of the MedSafety app, and then who can actually use the MedSafety app as I've highlighted earlier. And then as you click here, it takes you to the side of the MedSafety app. Then visiting your nearest health facility. So at the health facility, they can either use the paper-based format, or they can report via the MedSafety app as well. And then lastly, we also have the COVID-19 hotline, where one can also call and report. And then we also have the number, and to say, when you report, please select option 3, for in case those that cannot, those that don't have data and they don't want to save the reports and wait when they have data, they can actually use the other 2 systems, or they can also go on the SAHPRA website. Then fourthly, we've got doses that are administered. So the doses that are administered, this is a link to the National Department of Health website, whereby it provides the information regarding the doses that have been administered. So we thought it will be useful for the public to have a one-stop shop where they have information about the doses administered and the adverse events following immunization. So it will be easy for understanding. So on this page, basically, it's the summary of what the dashboard from National Department of Health basically reports on. And I will not go through the whole thing because it's already available, it's publicly available. So it will talk to how many vaccines have been administered for the day. It will talk to the number of vaccines administered per province and so forth. So there's quite a number of slides here that anybody can go on the SAHPRA website and they will see, or they can go on the National Department of Health website and they will find this information. Then we've got the adverse events following immunizations that have been reported so far. So on this page, as Prof has highlighted, this is updated every Friday based on the information that we have. And it's actually about 1 week in behind. So we're covering from the 17th of May. That's when the national rollout started. And this is up until the 31st of August. So it indicates that how many doses were administered by the 31st of August and how many adverse events were reported in the system. And what is the total percentage of the adverse events following immunization for all the doses that have been administered by that date. And we also stratify the information per vaccine as well. So this is for Comirnaty and this is for Janssen. And as you can see, the percentages are more or less the same. And then as you go down on this page, then we have the number of doses administered per province and as well as the percentage per province. So for instance, in Eastern Cape, only 0.02% of the vaccine has actually reported adverse events out of 1,389,343. So this basically is the percentage of the total doses administered per province. And then as we move down, we've got the adverse events following immunization distributed per gender and as well as distributed by age and stratified per vaccine. For instance, you can see that the blue part is for Comirnaty, while the greenish part is actually for the COVID-19 Janssen. And